Hello, welcome to Riversoft University. My name is Shelley Wolf, and today we will be reviewing Start of Care Part 4 Post-Assessment Clinical Summary. You will notice on our Start of Care note that under the Post-Assessment area, you see a page called Clinical Summary, followed by 485. The reason this is because the information you provide on the clinical summary will flow to your 485 automatically for you. By clicking on the clinical summary page, you will first notice that there are two fields required to complete this page. First one is date of ER visit since last home health visit, if known, and date of next doctor's appointment. You will also notice there are three text boxes. These text boxes allow you to add additional information that will flow automatically to your 485 in Locator 21 and Locator 22. In the first box, you will see my example, patient refused PT evaluation at this time. This information will follow other services in Locator 21 on your 485. The second text box is where you would add things such as a clinical summary. Patient is living in the home with minimal assistance. Caregiver is willing but requires training to properly care for patient at this time. House is very cluttered and throw rugs are present, causing multiple fall risks for patient. Patient uses a walker at this time, however forgets frequently and is unstable while ambulating. This information will be added at the bottom of Locator 21 on your 485. The third text box is information such as rehab potential, discharge planning, who you spoke to at what physician's office, to review assessment findings and obtain a verbal order for this care plan. And additionally, you can add verbiage here as well that you wish to flow to Locator 22. My example is patient receives passport services for home health aid in addition to Medicare services. On a start of care, we default the rehab potential, only requiring you to put in a small amount of information, as well as the discharge planning and who you spoke to at what physician's office. Now I will show you how this information automatically flows to the 485. By clicking on the 485, you will see in Locator 21 and Locator 22 our information automatically defaulted for us. If you right-click on the text box, it will expand the text editor. Here you can see under our services is our additional services that we added to the clinical summary box 1, patient refused PT evaluation at this time. You'll also see our clinical summary that we added in box 2, patient is living in home with minimal assistance. As well in Locator 22, you will see patient receives passport services for home health aid in addition to Medicare services, plus our rehab potential, our discharge planning, and who you spoke to at what physician's office to report assessment findings and obtain your verbal order. If we hit print 485, this will show you exactly what your 485 will look like. And you can see in Locator 21 our information that we added here as well as here, and in locator 22 here with your rehab potential, discharge planning, and who you spoke to at what physician's office. So this is how, by adding information into your clinical summary page, you can automatically flow additional documentation to your 485. Thank you. Bye-bye.